For the MonaLisa Touch, we're going to talk about what it is, why it should be used, and when it should be used. It's a fractional CO2 laser for vaginal use. Now, many of you would have heard about fractional CO2 lasers for skin resurfacing of the face. It's the same technology, stimulation of collagen. Some bright Italian guy decided to put it in the vagina and see if it worked. and it did. So you've got to hand it to him, right? So our original studies are actually from there. And I have copies of those studies for any of you that are interested afterwards. It became FDA approved for GSM in 2015. Well, what is GSM? Genitourinary syndrome of menopause. The symptoms include vaginal dryness, vaginal burning, pain with intercourse, but they may also include urinary incontinence, urinary frequency, and sexual dissatisfaction. Now, I'm not going to go into sexual dissatisfaction in any length tonight because it's a little too complex, but this is one reason for it, and that's the one reason that we're going to address later. The MonaLisa addresses the problem and it's non-surgical. All of the things that we've been using for menopausal symptoms have either been hormonal treatments or surgical treatments. This is non-surgical, non-hormonal, and it ablates, which means it sends a laser beam into the tissue, which ablates that tissue and creates a thermal activity around that cylinder of ablation, which stimulates collagen production. And it's the thermal effect that works, the secondary effect from the laser. It's clinically proven to bring lasting relief, and the Italian that we were talking about, come on, Dr. Salvatore, he did a study on 50 women. This is actually not his first study. Come on. Don't worry about signing in, just come on down. He examined, or he treated 50 patients and found overwhelmingly positive and immediate results with a highly statistical significant improvement in symptoms after the first treatment. The improvement in their physical and mental quality of life scores over baseline, and this was what caused this really to be developed and to take on a new life. This is the impressive slide to me, that it just changed from this thin surface membrane of the vaginal mucosa with that sort of thickness to that.
Wow.
That was in 2 months after one session. So, I mean, when you see the evidence, the histological evidence of how this works and what it does, you can believe that it's going to give symptomatic relief. That was very impressive to me. So it's clinically proven. The relief improves after the second and third treatments, which we recommend for longevity, because that improvement will last for a year or beyond if you do the 3 treatments in a row, which I'll talk about in a minute. And there have been thousands of patients being treated now in this country and overseas as well. So who is this treatment for? The MonaLisa Touch is appropriate for any female who's gone through menopause, as well as those who are experiencing postmenopausal symptoms for other reasons. Maybe a surgical menopause, they've had surgery and the ovaries have been removed, or they've had breast cancer treatments, or they can't take estrogen for one reason or another. They choose not to take estrogen. So it's estrogen being the operative word here. The lack of estrogen generally is what causes the problem, the symptoms here. So we can replace the estrogen, and that will have some effect. But this is quicker and much more significant than we would get with just estrogen. How many people might need this treatment? Well, in the age groups of 50 to 80 in this country, there are 56 million women and 3 million breast cancer survivors. If you do the math, that's 25,000 women in the Santa Barbara area. And 50% of those women have these symptoms. So we could be busy doing that. So how do we do it? With the pre-treatment evaluation, we always do a consultation and evaluation before we do the treatment, or we like to do it that way. That's preferable. At that time, we look at the symptoms that the patients have. We take the medical history, because there are some contraindications I'll get to in a minute. We do an examination of vaginal health. Basically, we don't want there to be any significant infection going on. And if there's a lot of prolapse, you probably need more than this. And that's why we're establishing that in the interim. There's a statement, a quantification of prolapse called pelvic organ prolapse quantification. It's a POPQ evaluation that we do on people just to see if there's prolapse, see if the bladder's falling a little bit, the rectum's falling, cervix. And so we want to establish that because this may not be the best for those more significant cases. If we decide that that patient is a good candidate for this, we'll create a treatment plan. We'll talk about expectations because nothing is going to be 100% perfect all the time. So we've got to look at that seriously and have the right amount of expectation there. And then we prepare for treatment. Contraindications are infections, as I mentioned, pathology, abnormal cervical vaginal pathology can indicate that we should either not do it at that time or treat the pathology first. Pregnancy, you might wonder, why would we do this in pregnancy? Well, it's a good question. It's obvious that you shouldn't do anything like this in pregnancy, but pregnancy is a progesterone dominant state, and some women have menopausal symptoms in pregnancy. And so we would not do it at that point. The prolapse I talked about, history of pelvic radiation, the tissues aren't as strong and they may not respond quite so well, so you may have to we can adjust settings on this, so we might start off with a lower power setting. So it's not an absolute contraindication. Vaginal mesh placement, which is a surgical procedure for treatment of prolapse. In some circumstances, we wouldn't recommend that a patient with a vaginal mesh. Although there is a mesh that's used in the form of a sling for urinary incontinence, which is not a contraindication. History of keloid formation, that's an over-scarring reaction to trauma. It's at this point it's a contraindication to it because we don't want to cause problems. So on the day of the treatment, the patient would shower and shave if necessary, if we're doing an external treatment. And most of the time we're not doing external treatments. I'll go into that in a moment.
So when you mean shave, like, or wax?
Wax, shave, yes. Exfoliate in whatever way you wish. We get all the consent signed, and we make sure that patients have medications that they might use, such as a soothing medication afterwards. If you don't have it, we've got it here. It's not a big deal. For patients who have had recurrent herpes infections, we recommend that they take Valtrex or acyclovir, one of the antiviral medications, to decrease the chance of there being an outbreak. It's not likely, but it is possible. And ice packs if we're doing external treatment, but it's not necessary for the primary vaginal treatment. So in the treatment, we place a sleeve. Do you have anything for me to show? A probe on the sleeve? Could you grab it? When I did my training, the doc that gave the training said he didn't ever use a sleeve at all. It's a little... Well, I'll show you in a sec. I've changed my mind on that more recently because I've found that it's been... With patients with pain with intercourse, it's going to be uncomfortable to put anything, speculum in the vagina, without lubricant. I really want to see the sleeve for a moment. Yeah, that's good. Although I can't open these.
That's my job.
That's good. Okay, the sleeve actually just goes into the entrance of the vagina and protects it. It's got spreads the labia and protects it from the probe which goes through here. And this is the laser probe. And this is in the vagina. This thing goes through up essentially as far as it will go. We don't push too hard, all right? And it's cold, I'm afraid. But it's then, because the way we do this, the laser beam comes through here. It's directed at 90 degrees this way. And so that pulse of laser goes, it just hits one little spot. And then we move it around 60 degrees and hit it again, and again, and again, and again, and again. And then we withdraw a centimeter and do the same thing. And then we take it back another centimeter and go through the circumference again and the same again. And so that takes less than 10 minutes to do. And it's, so the first thing we do, as I said, is place the sleeve, place the probe in, put the laser on the right settings. There are slightly different settings for a first treatment, a second treatment, and an external treatment. And then we treat the sequence just as I described. So it's simple and safe. It's 3 treatments of less than 10 minutes each. It's an in-office procedure, and it requires no anesthesia. Almost too good to be true. Some patients, most patients will have some slight sensation afterwards or some slight symptom after the treatment the next day or a couple of days. And that can be spotting, it can be vaginal discharge, might even be some urinary symptoms, little frequency, little irritation, urgency, or inflammation and irritation if we're doing the outside. Minimal goes away in a day or two and doesn't require any other treatment other than the soothing gels and so on. The question that everybody asks and everybody's interested in, does it hurt? And as you'll hear talking to some of our previous candidates here, it doesn't. It doesn't hurt. Laser energy on the face or on the skin hurts. So we have, if we're doing the external treatment, we wouldn't use the local anesthetic. But the vaginal treatment is painless. The probe may be uncomfortable in insertion or rotation, but we pretty much, through being creative in the way we do this, using the sleeve all the time, maybe even putting a little lubricant on the outside of the sleeve, which isn't going to affect the laser beam at all, I think we've overcome that second concern there. And once inside the vagina, the probe delivers the laser energy impulses. How much does the treatment cost? Initial series of 3 treatments is usually $2,500. A single treatments are $1,000. We prefer people to book 3 because they're going to get a lot better in one, but I don't want them to think that's as good as they can get, because it can be better than that. And so we'd like to encourage that. We're part of the promotion of, as you heard from the emails that we sent you and so on, there is a benefit in coming tonight, and there's a better price that we have, but we need a commitment from you if you're going to do that, of a down payment for that. Alternative treatment choices, and we just looked at cost ranges for this. If you use Premarin cream, Vagifem, which is a vaginal pill, Estring, which is a continuous release estrogen ring that goes in the vagina, or Ospina, which is an estrogen-like medication that's taken orally. Some of those are covered by insurance, some of them are not. It ends up being quite a lot of money over the course of a year as well. So none of this is cheap by any means. So the reason for talking about MonaLisa Touch is there's the minimal side effects, there's no downtime, and you get lasting results.
What does lasting mean?
A year or more.
When do we know when to come back? When do we know when to come back to you?
If you get any recurrence of the symptoms, then you come back.
Okay.
But what we do is we treat one and we book for the second and the third. Okay, so we book the 3 treatments, and if you're good to go for 5 years, good for you. Okay, and if it was a lot less, we would work with you on doing something sooner. Okay, so but the recommendations from the company and the studies that have been done are a year or so to repeat, which is that I'm glad you asked the question because sorry, I got slides, and I thought the next slide was a different slide, but no, nevertheless, we'll go ahead. The FDA approved this for vaginal discomfort, vaginal dryness, pain with intercourse. What we found is other symptoms, the bladder being treated as well, but it can be used externally just like the CO2 laser on the face. And we have a probe that will do that. So it can be used for labial skin tightening and strengthening if those tissues are sagging a little bit, not as tough as they used to be. Or you want some strengthening right around the opening of the vagina. Those could be treated. We'll do those at the same time. And we'll use a local anesthetic, a local anesthetic cream to do that. And that's going to be your choice this time. It does take longer to do it because we wait for the local anesthetic to work under those circumstances. There's a condition called lichen sclerosis, where nobody really knows why people get that, but it's an irritation and discoloration of the labia, the vulva, which responds to this treatment as well. And vaginismus is an unusual circumstance where the vaginal tissues and vulval tissues are extremely sensitive to touch. And this can help those areas too. But they're off-label indications, and the external probe, and I have to tell you, this is the only practice that has an external probe in the area. So, basically self-survey, is this for you? Are there any vaginal discomfort symptoms that are regular? Does it affect you other ways? Dryness, itching, discharge, odor, irritation? Have you had cancer treatments? Do you choose not or cannot use hormone therapies? Are there any urinary problems? Would you like to have sexual relationship without discomfort? Well, I think the other question is, would you like to be able to have sexual relations with discomfort? I would say the answer is no. So you need to treat that. But we think of this as a rejuvenation of the vaginal tissues. And that's what's happening with the skin on the face with the CO2 lasers.